As was mentioned, my name's Hartrick. I'm president of the Canadian Men's Health Foundation, and I'll start with the standard disclaimer slides that I understand that we have to do in order to present to such an esteemed crowd. Now, be a little patient with me. I've got to advance on two different laptops because of a little technical glitch, so there might be little bumps between slides, but we'll move along as quick as we can. The first is that we have nothing to declare. Sorry, what's the wrong slide? There. First is that we've received some financial support from the provincial government in terms of a grant, donation from Sun Life, donations from individual donors. We don't have anything to disclose regarding value in kind. And I'm not actually, of course, a faculty member. I come from the corporate world, but I have nothing to declare in relation to commercial interests. The Canadian Men's Health Foundation is a new national not-for-profit that will launch in June. We're still going through our build-up phase right now, and I'll tell you more about that. Its mission is to try and mobilize men to take better care of their health. So we're a health promotion prevention organization. Just on that. It came about as a result of the vision of our chair and founder, whose name is Dr. Larry Goldenberg, who created the Men's Health Initiative of BC in 2009 and was the springboard to this. I at that point met Dr. Goldenberg when I had moved on from my communications and marketing career, and he was looking for somebody to help provide a marketing perspective to the health education he was trying to do. So it's been a very interesting couple of years learning about that, and tell you more as we go along. The primary idea, the primary thing he wanted to do was to have a vision in which a nation in which men not only valued their health themselves, but a society in which the final piece of the family health puzzle was valued. Which, of course, you all do here, and I'm very impressed that so many of you are here in this room today taking an afternoon off of everything you're doing that I don't know how demanding your careers are. Because as I've gotten involved, the men's health gets relatively low emphasis, and that low emphasis is also by men, and by society, and all of which of those factors are probably interlinked in the cause of men's health problems. So to start, I'm going to talk a little bit about why men don't go to the GP. So a bit of research that was done on that. And then I'm going to talk about why men may not be proactive about their health at all, and the research that we've done over the last year to look into some of the psychology around that. Hopefully that'll be useful to you as you engage with or try and communicate with your male patients. And then finally I'll tell you a little bit more about the initiative and what we're doing and what we're building towards. So because it's generally known that men don't access physicians nearly as much as women, looking around for some research, I was fascinated to do that because I was one of those guys. And my kind of badge of honor was, I haven't seen my doctor in 5 years, and then I haven't seen my doctor in 6 years. Right? I have my own theories about why that is, but let's take a look at what the research says instead. So, there was some research. There wasn't much we could find on this topic, by the way. A study published in the Journal of Family Practice in 1999 still seems to ring true to me. It was based on interviews with family doctors about why they felt men didn't come and visit them. And it fell into really two different categories. Personal barriers, feeling vulnerable to the office, giving up control to their GP, sharing, particularly if they had to, when they made the appointment, if there was a female receptionist who was asking for the reason for the visit, and then of course on into the doctor's offices. The others were like systemic barriers: waiting time, hours, location. I'm sure none of this is news to you. Lack of male health care providers. Some doctors feeling that some of them, the men felt would be easier for them if they could talk to a male health care provider. And taking time off of work, putting their own health at the lower part of the totem pole. Were all reasons. And I get this, because as I said, I was one of those guys. So if men like Mr. Griffin aren't going to see the doctor and so informed, why? Is it because men are generally actually in pretty good health. Well, we decided to commission a UBC to do some research to verify the various statistics that we hear flying around about men's health. So I'm going to show you a couple of results of that. That 70% of men's chronic health conditions are caused by lifestyle. That men are 50% more likely to die of diabetes, 79% more likely to die from heart disease, 60% overweight or obese, 40% more likely to die from cancer. Another way of looking at that suicide number is more times likely to commit suicide, and on average spend about 10 years in poor health-related lifestyle. And this means at a stage where they need somebody helping take care of them, like a family member. So, obviously, there is a problem. And why aren't men paying attention? Particularly when, as we were saying, that 70%, we're told, doctors, healthcare organizations, academics all tell us that about 70% of this, roughly, could be prevented by upstream preventative behavior. And it's the basics that the guys already know, that we already know, right? Eat better, be more active, get to sleep, manage your stress, cut back on the alcohol, get rid of the cigarettes, see the doctor. Those are all very basics. But what is it? Why is it that men aren't paying attention? Excuse me, I just have to scroll here. Some psychologists point to the theory they call the hegemonic male. Some of you may be aware the theory sort of bundles together all the kinds of attributes of being a guy. Strong, silent, self-reliant, winner, emotionally not sharing. That all these things together bundle together into this idea. So asking for help, like if you're depressed, doesn't fit this whole kind of idea of a male role. And then there's testosterone. Our resident scientist believes that sort of hegemonic drive, this kind of attitude, is fueled by the greater presence of testosterone in men. So what might be some of the effects if that's really the case? This is called dominant response to dominant challenge. This is called sensation seeking. And actually, risk-taking, of course, as you wrote, probably along with suicide, is one of the biggest causes of the tragedy of so many young lives being lost. Or perhaps this is the cause of so much testosterone in the brain. But whatever the case, what's clear to us from where we come to this, and probably clear to a lot of you, is that motivating men to be very proactive about health, getting them to adopt these healthy lifestyle behaviors, requires an approach that's very specific to men. It requires, if we look at this as a health promotion campaign, it requires a way in which it relates to the way that man feels about being a man and the way he sees his role in society. Interestingly, by the way, the Korean royalty in the 19th century had a very interesting approach to dealing with this. Future royal guards had their testicles removed when they were in puberty. Now, interestingly, they lived 14 to 19 years longer, and they were loyal and trustworthy through the entire time. So I'm sure there's a lot of women who in the room who would like to see that practice. However, we can't do that. So we've got another marketing challenge. This is probably got to be one of the toughest marketing things I've ever encountered, because we're trying to reach men who are otherwise not interested in adopting these healthy lifestyle behaviors. They don't see the urgency in it. So we set out on a path of systematic research ourselves to try and discover some of the psychology of the way men viewed their health. And we did 4 different levels of research. We did an academic and grey literature review around North America, Australia, UK. We conducted focus groups with men in 3 different cities across Canada. We did a quantitative survey of 1,200 men across Canada, and we did what are called morphological, these one-on-one, in-depth, 90-minute interviews with an interviewer who probed into sort of what was some of the subconscious thinking that man had in relation to their health. I thought one of the outputs that might be of interest to you is this, that researchers put together as one of their conclusions, and that is that men generally tend to be in either one of six different modes when they think about their health or their attitude towards their health, and particularly preventative health. In the upper right-hand corner, men are sort of in this denial of vulnerability. I'm invincible, I can do anything, I don't need any help. Often related to younger men. The one on the right, the suppressed, this is men who put their health at the bottom of the totem pole. The bottom below family, career, and other pressures that they feel that they might have in their life. And health is kind of the last thing that they think about. They'll say, I just simply haven't got time, or I don't know what to do. Controlled intervention down at the bottom right, this would be a situation where I kind of call it somebody having the aha moment. My uncle's had a heart attack. Boy, I better maybe think about something this myself. Or I'm suddenly having a health problem and it's caused me to be aware. Or maybe I've just hit 40 and I'm going, oh, okay, maybe I should think about this. So people who enter this phase, we find that some of them will then move on to adopting better lifestyle behaviors, and others will eventually go back to where they are, but it's a moment. Balanced care, which I'm sure probably a lot of us are in this room, where we kind of generally try and balance off our lifestyle to help be healthier. The upper left here, the delegated, these are men who see their health as something that their partner kind of tells them what to do. Like, go see the doctor, and I'm sure you saw that. We saw that in the research that we saw about seeing the doctor. Or they see it as a shared responsibility between them and their wives. And the last is a category they call learned helplessness. These are the people who sort of throw their arms up in the air, and it's like, what's the point? Whatever's going to happen is going to happen. Often these are people with really poor social determinants or other issues that are quite deep-rooted that would need to be solved to help improve it. So what their conclusion was, that they found that the men that they interviewed were generally in one of these 6 different categories at the time they talked to them. I mean, these may change over lifetime. I myself have gone from probably when I was young being up there in the invincible denial of vulnerability, now be down in the balance side, so it could move around. But it may give you a little bit of insight, and what I'll quickly run through here are some actual quotes from people who were interviewed on these. So this first one is in the learned helplessness, the sort of I give up or it's no point, I guess I eat my way through my emotions. I've taken the approach and screw it. I don't care about myself, so I'm going to order whatever I like. This 37-year-old male. Invincible. When I think about health, I think about doing anything I want. I can have sex 3 times a day because nothing can slow me down. Okay, he's 42. What's going on with him? Acting, this is the bottom of the totem pole guy, puts everything else. Acting like a man is doing whatever you need to do to survive. As long as your family is happy, then you need to sacrifice. Next, after my sister had an aneurysm, this is the aha moment, I started getting tested and went on a really strict diet. I managed to lose 30 pounds, but I couldn't maintain it. So a lot of people here will slip in or out. They'll either continue healthy or go back to the old lifestyle. Balanced care, this fellow. What's most important is making sure your family gets into a healthy routine with their lifestyle and food. That's what came from my dad, and that's what I want to pass on to my family. And then in the shared or you tell me what to do category, before my wife, I'd never thought of diet as exercise or exercise is fun. That can help keep my family together. So this. When we've shown this to other physicians, some of them have said that this might be helpful in you kind of thinking about the different ways in which men are coming into your office, and they might be in different psychologies that need a different nudge in order to get them to adopt healthier behaviors. Out of all that, though, we have sorry a second here, I'm going to advance my other one. We are focusing in this foundation on preventative doing health prevention and promotion with men who are 30 to 50 years old who have devalued their health. In other words, those men, the right quadrant, that have said, oh, family, career, everything's kind of taking precedent. And the reason we're focusing on that age range is that over 30, generally, our research seems to show that over 30, more amenability to thinking about future health. And under 50, because we're trying to reach men before the legacy of the bad behaviors, the poor behaviors have taken root into other health problems. So we want to try and reach into that sector. The areas we'll focus on are all the things you already know. Eat better, be more active, get your sleep, manage your stress, cut out the smoking, reduce the alcohol, see the doctor as necessary. All of which sounds really straightforward. What we have to do, though, is apply principles to how we do that. Because back to what I was saying before, we have to be able to message men in a way that they'll respond. And we picked out 10 guiding principles out of the research we did with men in terms of how we market the health promotion to them. Guilt-free. Help me understand where I stand versus you just telling me where I stand. Give me ownership, control, build trust with me. Kind of embrace my masculinity, don't try and take it away. Add an element of friendly competition or fun if you can in this health promotion side. Offer me benefits and incentives, even if they're just kind of the emotional ones, like being able to be active with my daughter when we're both older. Social support, social networking with other men, and this is a really key thing in everything we're going to do. Is we were told by men in this category time and time again, and the behavior change theory people who were consulting with us told us the same thing, that to mobilize people of this category is to not ask to do too big a thing. Saying to a guy who's this unmotivated, go to the gym, is too big a task. There's too many reasons not to do it. It's complicated. Instead, walk up a flight of stairs, scrape the mayonnaise off the burger. So we will be focusing on giving small, easy to do, measurable steps to start tracking towards behavior change. To do this, we need to do sort of 3 steps. Is to get the men's attention, which is where our marketing campaign is. I'll come in a minute. Get them inspired and then give them tools to get them acting. We've brought in an national advertising company that's an award-winning group to help us do this, because after all, the advertising industry has made us all go out and buy things we don't need. So surely they can help us figure out how to mobilize men to do something we know they need. And they're working on the creative concepts that we'll be launching in June. We'll have 3 specific things, or 2 specific programs, and then that we'll be launching in June, both of which may be of use to you with your patients. And we'll have some sports celebrities who are going to help us get the message out. The first is an online men's health risk assessment tool. So this is a survey in which you fill out 18 questions with some subcategories in them. It takes about 10 minutes for the guy to fill out, and it runs it through an algorithm with a weighting system. It gives a report on the risk of developing the 7 most common conditions that are either specific to men or predominant to men. Oh, I'm sorry, I didn't realize I'm just about up. I'll rattle through these quickly. And the 7 are these. So it gives a red, green, yellow light, and then populates this with tips and techniques, to suggest better behavior. We have, very lucky to have some celebrities coming on board to help us promote the message and help engage their audiences. We'll push a lot of this out through advertising, but largely we're going to be a presence online through the internet and social media, because men tell us that's where they look for most of their health information. We'll launch in Ottawa in June. Then we're going to have Canada's first Men's Health Week, the 6 days leading up to Father's Day, to help provide sort of an extra element to Father's Day around health. And from there we'll promote through the internet 365 days a year. What can you do? Well, we're pre-launch. What would be great is if you could go to CanadianMHF.com, where you'll see a button on our temporary page, say keep me updated. That will allow us then to send you a link when we launch in June, and then there you will you'll be able to review our website. There'll be PDFs and tools that you can download. You can check out our risk assessment tool, and if any of that is useful to you in working with your patients, that would be great. What we really hope to do together is change this phenomena. We believe it can happen. I know that all of you are extremely dedicated. That's to men's health, and that's why you're here today. And I humbly ask that perhaps we could be another resource for you as you go ahead. Thank you.